Hello, everyone. Welcome to the 2020 Conference on Metastatic Breast Cancer. Thank you so much for joining us for medical marijuana to manage symptoms and side effects. My name is Abigail Johnston, and I have been living with metastatic breast cancer for 3 years. I attended my first LBBC conference last year, and I've been so honored to be a member of LBBC's 2020 Breast Cancer Conference Advisory Committee this year. I'm especially excited to serve as your moderator today because medical marijuana has given me the ability to manage my often overwhelming pain and yet still remain connected to and present with my children who were 1 and 3 when I was initially diagnosed. For me, narcotics clouded my mind too much and I didn't like the feeling, plus all the nausea. Joining me today for the discussion are Sara Jane Ward, and an assistant professor of pharmacology at the Temple University Lewis Katz School of Medicine in Philadelphia, who researches how the parts that make up the marijuana plant can impact the nervous system. And Dr. Brooke Worster, an associate professor of medicine at Thomas Jefferson University, also in Philadelphia. Dr. Worster specializes in offering supportive care with a special interest in the understanding of medical marijuana in a collaborative team approach. Welcome, Dr. Ward and Dr. Worster, and thank you so much for offering your expertise today. Behind the scenes, we have Erin Alum Hansen, the Director of Outreach at LBBC, who will be on the chat with us and looking at your questions. So please take a look at the bottom of your screen. You have 2 options to communicate with us. There's the chat feature. Would love to see everybody participating there and saying hello. Then we have the question and answer place. It'll be so helpful for us if you keep those questions in the question and answer area because we can more easily address your questions there. But please, tell us your stories in the chat area. We would love to hear from everybody. We are so grateful to be able to provide what I know will be a very informative session for you. We are all experiencing challenging times, and your support is even more important. So if you are able to send in a donation to LBBC, you can do so on lbbc.org. The donate button is on the top right of the navigation bar, and it's orange or salmon, some really cool color there. Also, please follow us on Instagram and invite your friends. LBBC is pretty close to 10,000 followers, which is an important milestone to be able to share even more pertinent information for everyone. The last piece of housekeeping, and I know it's a lot of housekeeping, but bear with me. The last one to address is that while I know everybody is so excited to hear from these experts, they can't address your specific situation or answer your specific medical questions. This seminar is a high-level overview so that you can better understand what questions to ask and how best to work with your individual team and how you might be able to incorporate medical marijuana into your specific regimen. Additionally, since I'm a lawyer licensed in Florida, I'll probably be offering some insights from that perspective. Nothing I say today is going to be legal advice, and nothing our experts that they say today is going to be medical advice. So just keep that in mind when you're asking your questions. If we need to follow up with you afterwards, or if you want to follow up with any of us afterwards, check out our contact information in the bios. We absolutely want to hear from you. And so, on to the questions, because I know you all are really excited about that. So, we have people today here who are very familiar with medical marijuana and others who might not be so interested or might not be so up on information about it. Let's start with having Dr. Worster explain how people with metastatic breast cancer are using medical marijuana today and what side effects they're using it to treat. Dr. Worster.
Thanks, Abigail. And hello, everybody. I'm so excited to join you, albeit in the virtual format. I think this is going to lead to hopefully a great discussion today. So I think it's a great question, kind of what are people looking to medical marijuana for, especially our breast cancer patients? I think my answer is it's all over the board. I get a lot of people that are sort of coming to talk about use, looking at it for a side effect of either a surgical intervention that they've already had, chemotherapy that they are about to start or have just started, or radiation. So oftentimes pain and I would say nausea are probably the top 2 But then very sort of close after that are sort of the anxiety, insomnia component, as well as appetite. So you can see sort of symptomatically, it spans the gamut. And all of those, I tell people, I think there's a decent chance you might find some relief or sort of a lot of success with this approach. I would say I would be remiss not to kind of add in the group of people that come to talk to me and want to know more about the potential of using it in some adjuvant way as kind of an anti-cancer therapy or for anti-cancer properties. I find that that's less, although I think there are probably more patients out there that get information about that and feel intimidated about kind of admitting to that. Although I would encourage all of you to be 100% open and honest with your physicians about this. I think that it helps us up our game to know exactly what's going on and what you're thinking. But it's completely a reasonable approach in either direction.
We already have a live question along these lines about, does cannabis help with opioid-induced nausea? Is that something that you've seen in your practice, Dr. Worster?
Yeah, for sure. I will say that nausea in general is one of the, I tell people, kind of lowest hanging fruits for success with marijuana use, whether it's related to chemotherapy, other medications, or opioid-induced nausea as well. And I think there's probably two ways that I see it help. One is that using that as an adjuvant for your pain can actually help you reduce the amount of opioids for some people that they're needing. So in that way, it's usually a additive effect. The more milligrams of whatever opioid you're taking you're on, the more you're going to experience kind of those unwanted side effects. So if you can reduce the amount that you're relying on opioids, it can be helpful in that way. And the other way is just generally from its antiemetic effects, from kind of a central CNS perspective and kind of targeting those receptors that are sort of really triggered by opioids and kind of related to the nausea.
And I can say from a personal experience, all of those things have absolutely been hugely beneficial to me in my use of medical marijuana to manage my symptoms. We'll talk more about some of these things, but let's move on to looking at the actual cannabis plant. And so we're going to turn to you, Dr. Ward. What are the parts of the cannabis plant that have an effect on these side effects we're talking about of metastatic breast cancer? And secondarily, or just the next question that comes along is, what do we know about the plant's impact on the body from your research?
Yes, hi. So the cannabis plant itself contains thousands of different chemicals that we can sort of put into different categories or different classes of chemicals. And one of those are what we call the cannabinoids. And THC is the most well-known cannabinoid. There are over 100 different cannabinoid chemicals found in the plant. Again, THC probably the one that people are the most familiar with, and now also sort of rising in attention and discussion and interest is cannabidiol or CBD. Again, beyond those, there are dozens of other cannabinoids that we've barely started researching. And outside of those cannabinoids are other chemicals that belong to other classes as well. So out of these hundreds of different chemicals, we have some understanding of the effects of THC and now CBD as well for their potential to treat the side effects of cancer, and as Dr. Worster mentioned, researching the potential anti-cancer effects of those chemicals as well. So some of the oldest known reasons for people using cannabis going back thousands of years was for the treatment of pain, as well as for the treatment of nausea. And so, these are some of the oldest reported medical uses going back thousands of years. And of course, we have a lot of research that's currently going on to look at that. And as well, interestingly, both of these chemicals have also been studied since the 1970s for their potential anti-cancer effects, either just looking at cancer cells in a laboratory or in animal models of cancer. And so most of the research focuses on THC and CBD in those areas, as well as Dr. Worster pointed out, for anxiety relief and treatment of insomnia. So most of my research focuses actually on CBD. As we all know, one of the major concerns that both patients and physicians and family members have is how safe the THC may be in cannabis. So starting a little over 10 years ago, one of the research focuses of my laboratory was to turn to CBD, which we know has a much higher safety profile, does not have abuse potential, does not have learning and memory impairing effects, to look at the ability of CBD to decrease pain associated with cancer and specifically with cancer chemotherapy.
Do you find, Dr. Ward, that there's a bit of a tension between people who want to use a specific part of the plant, say THC or CBD, and then those people who are advocating for using the whole flower?
Yeah, and I hope that it's not a tension, but sometimes people who feel very strongly one way or another can sound a little bit maybe defensive in their stance. Certainly in the medical community, in the patient population, in the research community, there are people that I talk to who argue for the use of the whole plant or for the use of single agents. The argument for use of the whole plant is really going back to sort of a holistic and sort of herbal medicine type of approach, where some people feel strongly that the potential of cannabis really lies in this wide range of chemicals in the plant. There are very few actual constructed studies to address this. It's a major undertaking to have either a major clinical trial or even laboratory studies to try to determine this. So there is very little evidence, scientifically speaking, to suggest that the whole plant provides either a much larger effect size or that it might be safer. But I think it's important to continue to explore that possibility. And looking at the single agents, I think it's a little bit easier to understand why some people would be more interested in CBD, for example. As I mentioned, people turning to CBD because they find that because the drug has less potential adverse effects as far as producing a high or producing other central nervous system effects, that if we can determine that CBD is as effective as THC or whole cannabis, that this could be a very appealing approach. And this is really what most of the research in my laboratory focuses on. Again, in animal studies, using rat and mouse models, can I achieve the same benefits with CBD as far as treating pain and other symptoms associated with cancer as I can with THC? Are there any avenues or areas where THC is better? And what I'm specifically interested in is there truly a benefit of combining THC and CBD as a starting point and then slowly adding on some of these other chemicals that we think might be of interest as well?
Thank you for that. I know there was a lot of meat in that explanation, so be sure to ask questions in the question and answer area if you have specific questions. One of the questions that comes up a lot with patients, and this is over to you, Dr. Worster, is the idea of THC interacting with hormone-positive breast cancer. Yeah. And additionally, I'm going to throw two things at you here, the THC and hormone-positive interaction, and then this pathway, the CYP inhibitors, yep, and how cannabis may interfere with a lot of the CDK4/6 inhibitors that a lot of people are on. So if you could address both of those concerns, that would be wonderful.
So I will do my best. I think here's the biggest problem with kind of the real scientific meat behind cannabis is, just like Dr. Ward said, there's a heck of a lot that we just don't know. So I can tell you that we do know that the endocannabinoid system is sort of the endogenous or inside of our own body system that produces chemicals that are very much like, sort of mirroring the parts of the cannabis plant. And it's super complicated, right? It's not just a straightforward path. So it sort of inhibits and induces all kinds of different things in a complicated method. So to that first question about hormone-positive breast cancer and any interactions between any component of the cannabis plant, specifically THC, there have been preclinical studies where they have put sort of very pure THC in cancer cells and have seen that it has changed the doubling rate of those cancer cells, sort of slowed that down, right? And there is some evidence that there are a receptor that is expressed on some of the tumor tissue that mirrors our what's called a CB2 receptor or CB1. It's kind of the cannabinoid receptors. So there's clearly something there. There's also been a concern that there is a complicated interaction with those receptors in your body that may potentially produce the opposite effect, right? This has only ever been shown in either sort of a petri dish with cells or potentially sort of a lab animal, like Dr. Ward was mentioning. We do not, and there are absolutely zero kind of actual clinical trials to date anywhere, to my knowledge, that are looking at this in humans or even close to it. We do not have any evidence in any way, even just from a population health perspective, because we know cannabis is the most widely used drug in the world, and we have never been able to kind of pin down any kind of what seems to be a causal outcome, meaning any actual clinical outcomes are changed, either better or worse from use. So the way that I guide my patients is I say, listen, there's a lot to this that we don't know. But what we do know is that it seems to be a fairly safe, tolerated substance in your body. Your body produces something somewhat similar to this kind of, now, you can extrapolate that to the idea of opioids, where some is produced in your body and you can certainly kind of take it to the nth degree, but it seems like it might be something that would be sort of fairly safe and well tolerated. The other question about the drug-drug interactions, we do know that there are lots of drug-drug interactions, but the one thing that we know that is pretty safe to say is that if you are ingesting cannabis in any, I would say, reasonable quantity, there aren't kind of meaningful clinical differences that we know of. Now, there's not a ton of kind of pharmacokinetic studies in people looking at like really effects of exact drug level. But when we've measured it in patients that are taking cannabis, it hasn't been a meaningful clinical difference. So while they're being sort of processed, so to speak, by some of the same systems in the body, this happens all the time between lots of drugs that you take all the time, Tylenol, all kinds of other things. And as long as you're taking it in like a reasonable human quantity, it doesn't seem to have any sort of very significant, meaningful clinical impact on the level of the drug in your system that we know of. Take that with a grain of salt because, again, it's not like the way any other sort of pharmacotherapy that we use has come to sort of be tested, right? It's never going to go through a phase 1, 2, 3 clinical trial like all the other drugs that we're talking about. But we have, back to what you mentioned, Abigail, kind of decades of sort of experiential reports, and there's never been something that has stuck out as some kind of a signal through all of the noise that there might be a really troublesome interaction here.
Thank you for that. And I think it's really hard for people who are passionate about what they're doing to say, hey, we don't know. And I think it's important for you guys to hear today that you've got professionals who are acknowledging that there are things that they don't know, but they still are helping their patients walk that through. So thank you so much for that. I would also add from my own personal experience, and I have worked with a cannabis nurse, and I think that Erin can share the link to the association. And I have found the nurse that I have worked with to be extremely helpful in giving me some good practical benchmarks for, say, the dosing, which we're going to get to in a few minutes, but also this idea of interaction, and gave me the rule of thumb. So rule of thumb, that's not medical advice here, but that I would take, because I was on Ibrance for 2 years while I used medical marijuana. I'm on Kisqali now, in addition to Piqray. So I'm still on a CDK4/6 inhibitor. And I always make sure very carefully to take, I don't take my cannabis and my CDK4/6 inhibitor together. I always wait a few hours to take it. With Ibrance, I waited about 2 to 3 hours. With Piqray, I wait a little longer just because we don't know a lot about their interaction. So just to give you guys that rule of thumb, if your doctor is not somebody who's able to give you those experiential anecdotal suggestions, the cannabis nurse I work with individually has been doing this for 30 years, which is a lot more than any of the doctors that I've seen. And she has seen that over time that those things tend to be a little bit more helpful in terms of waiting so as your body is not overtaxed. So just as a thought for everybody who's asking for those concrete things, because I know that's so important. Now, both of you have alluded to this idea of we don't know the impacts, we don't know why it does the things that we do. So let's start with you, Dr. Ward. What can we do to encourage more research into the cannabis plant?
That's something that obviously I spend a lot of time thinking about. I will say that, within the last 5 years, the amount of research has truly been exploding. So I started doing research in the cannabinoid field about 15 years ago. And my experiences in so many different ways, from what the scientific conferences were like, what the funding for researchers like myself was like, what the attitudes of patients and physicians were like, is just changing so rapidly. And then the legislation changing so rapidly. This has been a grassroots movement of patients across the country pushing their states to change legislation. And then again, for me being really a CBD researcher, the changes in legislation that have led to the legalization of hemp-derived CBD products is also really going to lead to a huge increase in CBD research. And I don't want people to have the impression that there's not a lot of research. There is a lot of research in my world of cells and animals, as Dr. Worster mentioned. What is greatly lagging behind is clinical trials. I think it's extraordinarily important to keep talking about anecdotal experiences. This is not something that I would have said 10 years ago as a researcher, but really my research has been so impacted by talking to people who tell me how their lives have changed through using medical cannabis. And we don't often, as people who work with mice and rats every day, we don't often get to hear such positive feedback, about the kinds of things that we're doing. I think it's hugely important for people to continue to speak out about their experience with cannabinoids, as well as continue to pressure the government to change laws. So just to give you a little bit of a picture of being able to test these drugs clinically. it's been true that for decades, clinical researchers have been able to study THC or CBD or cannabis effects on humans in a laboratory or medical setting. However, what they had available to them was extremely limited. So the cannabis that has been researched really up till now has been available through the government. And, talking about dosing, it's been one strain of cannabis that has a certain percentage of THC and a certain percentage of CBD, or certain doses of THC or certain doses of CBD that can be in many ways very irrelevant to what patients are using now. This massive range of different strains that may have really high CBD content or maybe even really high THC content that hasn't been looked at clinically. And then as well as these, hemp-derived CBD products. So legislation, even now with the states, so I'm in Pennsylvania and we have a pretty excellent medical cannabis program, and the dispensaries have a lot of different products. As a researcher at a federally funded institution, I don't have access to, or a clinical researcher, a physician does not have federally legal access to run clinical trials on those products. They still are limited to what was available 50, 60 years ago from the government. So that needs to change, and everybody needs to do their, put on their activist hat and keep working on those changes. One really ray of hope that I'm very excited about, I recently helped review grants for Health Canada, and the Canadian Medical Cannabis Program is nationalized. And a massive amount of funding has just been infused into that system to do a lot of important clinical research, and a lot of it directed toward not only adverse effects of cancer and cancer chemotherapy, but the potential anti-tumor properties as well.
It's amazing how sometimes the United States is not leading in some of these important things, and that's great to hear that our neighbors to the north are doing a little bit about it, but we aren't. I just wanted to explain a little bit from a legal perspective the challenges that many researchers face. The cannabis plant, and specifically THC, is on Schedule 1. And that schedule is something that is maintained by the FDA. So the cannabis plant is in the same classification as heroin, the same classification as cocaine. And because of that, classification, federal laws then refer to that classification, and then that flows down to sentencing, that flows down to what is legal and illegal. At last count, 32 states out of 50, which is quite a few, have some kind of medical cannabis program where patients register, where doctors are overseeing that process. And I keep hearing from all of the activists in this area that we're getting to that point of having such a majority that it's going to tip over, and then it'll be much easier for it to become get off of Schedule 1 and become federalized, legally federalized. So one thing that each of you all can do right now today is Scott Gottlieb, who is our immediate past FDA, head of the FDA, he is on Twitter answering questions. If you type hashtag AskFDA, ASKFDA, and ask a question about this, this issue of cannabis being on Schedule 1. He has committed to answering some of those questions. So just a thought. The other thing that Dr. Ward said in terms of sending messages to your elected officials and making sure they know this is not a drug. When we're thinking about drugs that are harmful, this is medicine. And if we can help reframe as patients the conversation to be looking at it as medicine, I think that it will be a lot easier for people to accept looking at it that way. So along those lines, Dr. Worster, if you could speak to, if someone is interested in using cannabis for either the treatment of their cancer, which I know that some people really want to do, or looking at it from the perspective of treating symptoms, how do they find somebody to help them with that? How do they evaluate whether they're talking to somebody who actually knows anything? Because there's lots of people out there who act like they know about it. So tell us, how would you advise a patient who isn't able to come to you?
So I think that's a very good question. And I think one of the biggest failings that all of us on the medical side of the street have kind of perpetuated for you guys as patients is that we all need to up our game a little bit, right? I mean, speaking sort of to the advocacy and how we've even gotten to the place where we've gotten with cannabis, it hasn't been because doctors are sort of on the rooftop screaming, like, make this a medicine. I'll be honest, it isn't. It's because of all of you. It has been sort of a groundswell of changing the tide. So I will tell you, I feel hopeful also that we are making progress in clinical research, baby steps, but there's a group in Colorado that are doing kind of interesting things with this mobile lab where they can actually go to patients and get blood samples right after they've used it and kind of looking at different things like that. In Pennsylvania, we have a great program where I actually lead clinical studies that we do jointly with a dispensary. So we can't touch it or handle it or anything, but it goes sort of kind of furthers those efforts, right? We have to walk before we can run. But how do you find someone that sort of can help you? I think one of the biggest things to caution you guys about is to just get certified, or if you're in a state where it's legal, to just walk in and be like, what should I take? I think all dispensaries are very different kind of quality and have a different bent on sort of how they're guiding you. Keep in mind, that's a for-profit business. And I think a lot of them mean very well. And like in Pennsylvania, pharmacists are there, but I would caution you from just sort of taking that approach. I think there are a lot of resources that are out there that are reputable. I think the Cannabis Nurse Association is one that exists in a lot of states, if not all. I'm not entirely sure. But the other thing I would do is, again, ask. Word of mouth. Ask your friend, ask a colleague, ask your own doctor, right? Say, I'm interested in this. Like, what do you know? And our job, if we don't know, if you're not, and a lot of doctors say, I just don't know, but in their toolkit, they should know someone that does. So they should be able to refer you to someone that you can kind of have that conversation with. I mean, it's interesting. I work with a lot, probably 60 oncologists who have varying levels of support for the use of marijuana, but they've all sort of admitted, I don't know enough about it. And anytime someone asks, they say, let me sort of have you have a consult with my team. And so we sort of run through what we know, what we don't, some guidance about how to start using it. Even, I would say, just what forms it's available to you in. Because I think the thing that turns a lot of people off is that you can walk in and get something that is very, very potent, very high THC. And if you've never experienced that before, you're probably not gonna like it or tolerate it very well. So I think a lot of times I sort of start at the bottom and say, like, have you ever used it? Let's start there, and then let's build from there. But I would tell you again, kind of be an advocate for yourself and ask anyone else. Don't be scared to say this to any of your doctors, right? They're not going to get mad at you. They're not going to judge you, or they really shouldn't. They should have sort of some tool in their tool bag that is either some knowledge themselves or some way to refer you to someone that does. The other thing I would say, I always caution everybody, Dr. Google is sometimes a really wonderful sort of mechanism to find some information, and sometimes you can get into those scary rabbit holes that have zero medical validity about it. So I would sort of cross-check anything you're seeing and not just kind of take that as the Bible if you get something off the internet.
So true. We're always referring to Dr. Google, those of us who are patients, and thank you for that caution. I can tell all of you that my medical oncologist has never been all that positive about medical marijuana and would kind of chuckle at me that I was taking it. She never told me no, but she was very skeptical. And my palliative care doctor, who is also my pain management doctor, she's double board certified. She's the one who dispenses, and she's done in Florida, the doctors have to go through these special training programs to be able to prescribe it through the state. So she's the one who does that. And I have been super happy that now my doctor sends all of her pain patients to my palliative doctor to explore the possibility of medical cannabis. So don't forget that you can be advocating for these things with your own doctors. One of the things Dr. Worster said, and then there's much of the questions are about the forms. So I have a bunch of different things that are legal here in Florida, and then Dr. Ward is going to help me with some of the things that aren't legal here in Florida that I want to show each of you so you can start to consider what might be the mechanism. And I'll just tell you for myself, I never did any marijuana or any type of drugs going through high school, college, law school, etc. So I was the quintessential newbie, had no idea what I was looking at, and frankly had a little bit of a bias about smoking and, you know, rolling joints and things like that. I thought it was going to be really complicated. And so one of the ways that I often take my medicine is oil. And one of the dispensaries here in Florida is Cureleaf. And this particular dispensary is one where my doctor has toured it, and she has approved of the way that they do things. And here in Florida, anyway, they actually have a medical doctor on staff. I get my syringe and I take my oil sublingually, so underneath my tongue. And this particular bottle is just CBD. For me, I just take CBD during the day because I don't like the psychoactive effect when I'm with my kids. The other way that CBD comes, as well as THC, is in these capsule forms. For me, although I have them, the capsules don't take effect as quickly for me. And I don't know if that's just the way my body is, but that goes back to you got to figure out how your body responds best. My body responds best to the oil. The capsules seem to take longer to actually take effect. However, they seem to last a little bit longer. And so that's why I keep a variety of things on hand, because however my pain is in that moment, I may need something very quickly. Now, for what I call breakthrough pain, those days when I am just in so much pain, I will use these vape pens. Now, the vape pens come in all kinds of different colors and sizes. Each of them has a little cartridge with the oil in it. So most of the dispensaries that I've been to give you the vape pen that goes with their cartridge. And I'm sure that some people have seen some of these awful, awful, awful experiences of people who took the vape pens and did something to them, and then they blew up. That is something that happens when you mess with it after it, or you open it up and you change it, or you try to make it stronger or something like that. Don't do that. That's not a good idea at all. My dispensary also does these, I don't know if they're single use or they're more limited use, so it's not the same size. You can see that it's a little bit smaller, and it lasts for less time. My dispensary only does those for CBD cartridges, and it's supposed to be meant to put in your purse and take with you. I try not to do that because I just feel weird about having something like that in my purse, especially since you charge them, so it has a charge. And I'm always a little bit concerned about it being in the hot car and things like that. So everything that I've shown you comes with pros and cons. It comes with recommendations. And so whatever you get, make sure you really know what you're using, know when you need to use it. And then Dr. Ward, would you show us some edibles? I think you were looking for some gummies that are legal up there in Pennsylvania.
Yeah, so what I have here is just, and this is one of the most well-known brands. It's Charlotte's Web. And these are CBD gummies with 10 milligrams. And they don't have, they have a low enough content of THC to designate them as a hemp-derived product. So products that are hemp-derived CBD products by law have to have less than 0.3% THC in them. The reason why I have this container is because, like I said, this is one of the most well-known CBD companies. There are so many hemp-derived CBD products available. And it's, I think, a little bit of a scary space now. You know, again, being a CBD researcher, part of me was ecstatic when the CBD craze hit. Part of me is really concerned that people can go to their grocery store, gas station, massage parlor, and buy CBD products at the counter that may not be regulated in any way, shape, or form. The last study that I saw was something like 75% of all of these products tested off the counter had more or less CBD or THC that was stated. So this is, you know, a tricky space, which again is why I promote going through a physician and a dispensary to increase, you know, the amount of support you have with being directed toward different products. So these are CBD gummies. There has been some controversy around edible products in general, and Dr. Worster can probably speak more to this as well. As you mentioned, some patients' experience with certain formulations is that they have a slower onset, takes a little bit longer for them to work, but then they seem to hang around, and sometimes they can have a much stronger effect. And some people experience this with different edible products. Some states who have legalized medical cannabis programs don't legalize the edibles because they're concerned with the patient's ability to be able to regulate themselves how much. You know, I take a little bit of the edible, I wait an hour or two and I don't feel anything, so I take a little bit more. And you'll hear many stories of people that have had pretty miserable experiences with doing it that way, whereas other patients might not. So some people do have some words of caution towards the edible products. And there was something else that I wanted to mention, and I got myself distracted. I get so excited. Oh, I know. The other thing, you know, tying back to the question about metabolizing CBD. So it's important, again, to speak to your doctor, your pharmacist. In Pennsylvania, as Dr. Worster said, we're very fortunate that we have pharmacists at our dispensaries. Some of them are extraordinarily knowledgeable in the specific drug-drug interactions and the different liver enzymes that can be impacted by taking specifically CBD. One thing that, and again, not as medical advice, this is not my area of expertise, but a piece of advice that I always give is if you're interested in CBD products, I would have my liver enzymes checked. There is some research showing that very high doses of CBD can have a negative impact on the liver. There is an FDA-approved CBD called Epidiolex. This is a CBD that's approved for childhood epilepsy disorders. One of them, aside from what a medical breakthrough this drug has been for children with epilepsy, is we finally had, for the first time, very large-scale clinical trials with CBD. So thousands of patients have taken CBD under a clinical setting. And the one pronounced result that occurred was an elevation of liver enzymes. because there was so much effectiveness with CBD, the FDA went ahead and approved it. But there is, written on the label of Epidiolex is a warning that it could produce liver complications. So that scares me to think that someone can go to their grocery store and buy CBD with no conversation about dosing recommendations, no person asking you what other medications are you on, do you have some other liver complication. So in talking about CBD and dosing and drug-drug interactions, that's something that I really think is important for patients to be aware of. And then one last quick thing I want to mention when we were talking about available resources to find information. I've seen some scary things on the internet. I also Google everything. I mean, everybody does. One thing I would recommend is go to medical websites. Don't be afraid to explore scientific websites that you might think you might be intimidated by. My two favorites are PubMed. PubMed is where scientists go to look up research articles. Go to PubMed, it's very user-friendly, search engine, type in your question about cannabinoids. If you find a paper and it sounds really over your head, look at the authors of those papers. Look for scientific articles from authors from an institution in your state and email them. You know, I'm excited when I get an email from someone who says, "Oh, I've read about your research and I have some questions." The other website is clinicaltrials.gov. There are hundreds of ongoing clinical studies with THC and CBD. Currently only one right now for CBD and cancer, and that's a glioblastoma study. But it's a way to keep up to date with what is going on in this ever-changing landscape. So you can go to clinicaltrials.gov, type in cannabis, CBD, THC, breast cancer, or any other indication, nausea, vomiting, and see what clinical trials are ongoing and any results that may be posted.
Those are great recommendations, Dr. Ward, and not just for medical marijuana, not just for cannabis, for evaluating any kind of medication, especially if you're looking at something complementary or something that's not quote unquote mainstream. Dr. Worster, would you like to pick up on some of the things that Dr. Ward was saying about finding the right supplier of the cannabis? And then also, could you speak a little bit to some of the words that a lot of people are going to hear, like Sativa and Indica, and go into maybe which of those might be more suited to different issues?
Yeah, absolutely. I think I agree with Dr. Ward's recommendation about really kind of going through state-regulated dispensary channels to get products, because all states require that any of the dispensaries have had a second laboratory kind of approve and verify it is what they're saying it is, right? So as opposed to the stuff that you're getting at the drugstore or the gas station or wherever, kind of where, you know, Dr. Ward mentioned, it often doesn't have what they claim to have in it. When we've all looked at these papers where they kind of then on the back end studied it and found it didn't really have what it said it was. So for whatever you're looking for, go through that process. I think that's going to should give you a little bit more, I would say, kind of a little guidance, but also a little bit of comfort knowing that, you know, you're getting exactly what it's saying it is on the label. I would tell you that the other thing to know, and I think this is fair sort of across the board, is that if you're kind of wanting to start using this and haven't yet, and I mean, we do this, I tell my patients this with pretty much all things that I prescribe them, is really the safest, smartest way to start any new medication is to start low and go slow, right? That's like the adage that all physicians say all the time and are taught is start low, go slow. So start with something that's lower dose, lower concentration, and kind of be cautious with it. If you take one ingestion of something, whether it's an edible or an oil or whatever, and you don't feel anything 30 minutes later, don't sort of immediately redose yourself or double the dose or anything like that. Take it a little slower to kind of dip your toes in the water. Now, the vaporizing mechanism is obviously a faster half-life, so you sort of feel it quicker. So there's a little bit faster of a way to kind of titrate or know exactly what you're going to get. But either way, I would kind of take it with, patience as you're using it. Not oftentimes, I think, do people immediately sort of get it exactly right. And that goes to the same for, I'm a palliative care and a pain management physician too. Same as your doc, Abigail. I'm double boarded. And I would say a lot of times with anti-nausea medicines or opioids that I prescribe to people, a lot of times, their own body works better or worse with certain ones. I will say the edible question is one I get a lot. And Pennsylvania does not have legal dispensary THC-based or cannabis plant-based actual food products. And I'm on the fence with kind of how I feel about those and it has nothing to do with you guys using them. It's actually the things that have caused devastating outcomes more often have been because it is in a form that kids and pets really love if they see it. And when there have been devastatingly bad outcomes, it's because one of those two entities has sort of gotten into something. And so I sort of take that to heart that, if we're going to try to reduce any risk here to anyone in your household, having a food-based product does come with a little bit of risk, a lot of people make their own, you can get it in different states. So it's not a bad thing. It's just kind of take it a little bit with a grain of salt for that. And know that the biggest thing you can do is make sure you're putting it in some very, very safe location and space. And the other thing I would add, I think what Dr. Ward mentioned about the clinicaltrials.gov and PubMed is phenomenal. And honestly, here's an easy, sort of quick and dirty one that I like to use too is Google Scholar. Google Scholar is easy. It is another search engine that it's the kind of scientific side of Google that if you type in your question, it sort of lists a lot of publications that you can kind of take a peek at. So that's another really good, easy way to educate yourself.
Thank you for those, for that insight. We are getting down to the last few minutes. And so there are two more things that I want to make sure that we address. And Dr. Ward, if you could take the first one just really quickly. People are asking, there's hemp and there's cannabis. I've always heard that hemp is like the cousin of the cannabis plant. Are there pros and cons between using hemp and cannabis-derived products?
Yeah, so hemp and cannabis are the same plant. They were differentially cultivated thousands of years ago. So there was one plant, and certain populations used the crop for medicine and recreational use, and other groups of people started using the plant for a fiber source. And through differential cultivation, you basically got these two different versions, but they are genetically identical plants. It's just through sort of separate cultivation. You can basically think about your heirloom tomato versus a different, type of a tomato plant. And the result was that the cannabis that people were using recreationally and medically had higher amounts of THC and lower amounts of CBD. Hemp tends to have really, really low levels of THC and can have reasonable levels of CBD. And there's been this push for many cool reasons, especially just for an economical reason. Hemp is an amazing plant for so many different reasons. It also happens to be a source of CBD that people are really excited about and tends to have really low levels of THC. So I think it was just easier legally for states to make the argument, well, let's legalize hemp because really it barely has any THC in it. So now a definition was formed saying, okay, we'll call the product hemp if it has less than 0.3% THC in it, and we will remove those products from Schedule 1. So they are not scheduled anything as long as the product contains less than 0.3% THC. So this is appealing for people who are more interested in CBD, and it also changes totally the market for CBD for medical reasons as well as other reasons as well, because it decouples it from the Schedule 1.
Thank you for that. And the last question here goes to Dr. Worster about the social attitudes towards medical marijuana. And I have found that lots of people are very reluctant to out themselves for taking it, even though there are lots of people that are. That's never been an issue for me. And how do you see that playing out in your practice? It's perfectly legal for people to acquire. Are they still running into these issues?
Oh, all the time. I think that it carries a stigma with it that is unfortunate because of lots of the sort of socio-political trappings that occurred, back at the turn of the century, and kind of how we even got to this place as a Schedule 1. And so lots of people grew up with this vile weed, and you can kind of look back to they're funny, but sort of different kind of things that have been put out in various campaigns about it. So here's what I say is, the more that we talk about this as a medication, and the more that we normalize this in sort of our vocabulary, and by our, I mean all of us. My team consists of a social worker, a pharmacist, a nurse, and myself. And I think, as patients, as we normalize this as a therapy and not a sort of sketchy, illegal product, the more that will kind of create progress. And I just want to say super quick, you had mentioned Sativa versus Indica.
Oh, yes, thank you.
I will tell you, here's my 2-second spiel on that is, I would tell you, we don't have really great evidence at all about Sativa versus Indica even being really different, necessary, kind of different strains of the plants per se. For anybody, I would tell you, pay more attention to what is in it. What amount of THC and CBD is in it, and you will get much farther and you will do much better with it. I think the sort of recreational use has driven that Sativa, Indica, and hybrid kind of nomenclature. And I hold much less sort of medical stock in that versus just knowing the concentrations of the various phytochemicals.
Thank you for that. I know that can be a little bit confusing. I will say that in going to the medical dispensaries, the people there have given me the most reliable recommendations, as I've described, hey, I want to feel this way, or hey, I don't want to feel that way. So that's been very helpful for me, but it's really trial and error. It's really figuring out how your body responds to whatever it is. So just wanted to reiterate that. And with that, I will say goodbye to each of you. Thank you so much for joining us. Stay safe, everyone.